Hello and welcome to the third and final episode of Discover Series 3, the online education sessions from Salts Healthcare. If you have been unable to watch either of the two previous episodes where we explored the question of consent in general terms, in addition to working from a virtual platform, don't worry, it's not too late. This episode, along with all the other sessions, can be accessed via the Salts Healthcare website at www.salts.co.uk/Discover Series. Within this episode, we will hear from Barbara Milleret and Michelle Scripps, who share with us their experiences of setting up and running virtual consultations for pre-operative stoma assessment during the COVID-19 pandemic, and how this has enforced change and has positively impacted on their practice. As you can see here, it's clearly supporting the NHS and its vision to embrace new technologies, whilst continuing to provide excellent care for patients. For many of us, virtual and telephone clinics have become the norm, and for some patients, with the busy lives that they all lead, find it hugely beneficial. It's time efficient and it saves money. Barbara and Michelle are two experienced stoma care nurses working for Salts Medilink in North London, and they were instrumental in delivering this expert service to their cohort of patients throughout the pandemic and beyond.
My name is Barbara Milleret and I'm a community stoma care nurse working in Enfield in North London. Along with my colleague Michelle Scripps, we wanted to present to you today an exploration into the way virtual consultations have evolved during the COVID-19 pandemic, looking specifically at the role of virtual or telephone assessment in pre-op counselling for stoma surgery. This is in relation to a community-based stoma nurse team. So the aims and objectives of this presentation. So the purpose of developing this service was to support our NHS colleagues when caring for stoma patients having surgery. At this time, a lot of our colleagues within the NHS were being redeployed due to COVID, and we were approached to help plan, implement pre-op and side patients prior to their surgery. To adapt our service, we followed both the NMC and NHS England guidelines. These guidelines encourage new ways of working in order to support patients while preventing transmission of COVID-19. Both patients and clinicians were encouraged to embrace the virtual or telephone support concept, and this allowed our patients to be assessed virtually in the pre-op stage of their pathway without having to attend the hospital site for pre-operative visits. So what are virtual assessments and virtual clinics? Virtual clinics and virtual platforms are a whole new concept for the world of stoma care. Historically, we are very much seen as hands-on, and this has been shared in a recent article by Fulham, who agree and state that some stoma nurses may be a bit skeptical about ongoing use of triaging patients and supporting patients in this way. However, from our practice, we have found virtual platforms to be really beneficial, and we have had some very positive feedback from both our patients and our NHS colleagues, and we will present these later in our presentation. I will now hand you over to Michelle, my colleague, who will talk you through our pathway and how it works in practice.
Thank you. Our pathway was developed with senior nurse managers and included local team involvement. It was the result of the continuing pandemic and the need to minimise hospital visits. This would include a pre-op stoma counselling. We agreed a plan and developed a new statement of purpose. All was discussed with the colorectal CNS team and agreed before starting. Our team's CCG NHS email was acquired for all our referrals, which allowed for a secure communication route. We looked at Acrex, however, WhatsApp and FaceTime was deemed acceptable to use and readily available to most patients, and verbal consent was obtained when using virtual media and gaining photos. We next looked at our weekly timetable. Every Monday via a team Zoom meeting, we looked at patients who had been referred to us and what needed to be done, what pre-op packs were needed to be sent out via post or email. We devised a 2-week on, 2-week at home program. So if at any point someone tested positive for COVID, the whole team did not have to isolate. The nurse team do not have any admin support, and all patients were added to our e-note system at the point of referral. The next step on our pathway was to minimize hospital appointments. Our pathway allowed for us to follow up our patients effectively without the need to physically see them. It also allowed for us to plan a very individualized care plan for each patient, highlighting early on barriers to communication. We successfully pre-opted 100% of our patients virtually or by telephone. Patients felt safe knowing they didn't have to attend hospital appointments, and with our statement of purpose, knew the trajectory of their care plan. Once we had planned our week, we would contact the patient to introduce the team and our service, specifying our role within their surgical pathway. We arranged to send the pre-op packs and statement of purpose and booked a virtual appointment for the pre-operative counselling. The patient had at least 5 days to read all the information, but this was dependent on how soon their surgery was. The pre-planned call would take approximately 1 hour. This would include a full and clear discussion on what to expect during their surgery and how to care for their stoma post-op. We also discussed sighting, diet, lifestyle, hernia prevention, and any social issues relating to their stoma care. All of the above was then documented on our e-note system. During this time, it was highlighted if family members needed to be involved and how much information the patient had regarding their surgery. Any issues or concerns could then be fed back to the referring CNS for clarification prior to the surgery. All sightings were done at home prior to the patient's admission with full PPE worn. The sightings lasted no longer than 20 minutes if possible. This was in line with local infection control policy. Photos were taken with verbal consent of the sighting. Any issues or concerns were then escalated back to the hospital. This pathway has enabled open and effective communication between the acute trust and the community stoma nurse team. Our patients have fed back that they could see and appreciate the collaborative working between the hospital MDT and community stoma team. We would like to add that the pre-operative assessment virtually was part of a much bigger picture and an evolving service within our team. We had to also change our post-op pathway and home visit plans. We now have the opportunity to inform patients of this whole new way of working right from the beginning, making them aware of the service and what they can expect from us. This has alleviated fears and encouraged more active discussion with our patients on self-care and coping mechanisms once they've got home. This highlighted a couple of questions for us as a team. Would this have happened pre-COVID? Would we have gone out to see the patient sooner? Would their family have been as involved as they have been the last 18 months? We have had some challenges and some positives that have come out of this new way of working. One of the challenges was the length of time and sometimes the need for multiple telephone calls. One of the big positives is the positive impact and experience this has given the patients. From this graph, you can see 100% of our patients felt they had quality time on the telephone with us. On this slide, 95% of our patients were satisfied with the level of service they have received. I will now pass you back to Barbara.
Thank you, Michelle. To add to Michelle's data, we wanted to highlight to you how many patients we have successfully pre-opted virtually or over the telephone. As it stands this year, we've done a total of 36 pre-op assessments over the telephone. We're collating our figures for last year. We are assuming, because of the numbers, that we're on similar levels. So we're looking at 70 patients in total, 70 to 80 patients. This is a massive volume of work, and we are very proud of how we have coordinated this increase in our workload to help with the workload within the NHS. We also wanted to highlight the feedback that we have received from our NHS colleagues and from our peers. And this obviously is part of the feedback that we received from some of the hospital hubs that we have been supporting during COVID. We have worked very closely with a lot of hospitals in London, including a private hospital that was using the NHS were using specifically for colorectal surgery. Our pathway and statement of purpose is now utilised within the acute sector, and the local NHS stoma nurses are 100% supportive in how we're working and why we're doing it this way. So in conclusion, thoughts for future practice. We aim to continue working as we have done over the last 18 months. It is something that we're really proud of, and we're definitely looking to keep the virtual assessments for our patients, both pre-op and post-surgery. As Michelle has mentioned, this is part of a much bigger picture for us as a team to ensure safety and good practice for the coming months. We feel that we're offering patients a choice, and over the last 18 months, they have not lost out by being assessed on a virtual pathway. One of the questions that we asked is, was there a cost saving to the NHS? Could the service provision be further expanded to other NHS trusts? Could other NHS trusts look at the work that we have done and incorporate that into their colorectal pathway? This is definitely something that needs to be looked at in more depth in the future. Many thanks for listening.
And we hope you enjoyed our talk. Thank you.
Barbara and Michelle really highlighted here that despite the pandemic bringing such devastation to many of our lives, that some enforced changes to clinical practice can be positive. Patients felt safe as they didn't need to travel into hospital during the pandemic, and other healthcare professionals were full of praise for Barbara, Michelle and the team, reporting that the service was beneficial and a great support for them and their patients. This is proven by some irrefutable testimonials from professional colleagues, as well as conclusive feedback from the users of the service. Thank you for watching this episode, and indeed all of the episodes in this Discover series. I do hope you've enjoyed them. This episode, along with the previous 2 episodes, can be viewed on demand at the SALTS Healthcare website. Each episode can be stopped and replayed at your convenience, giving you time to write notes or reflect on certain aspects of the sessions. Please do click on the link at the end of the episode or from the main Discover Series homepage on the SALTS Healthcare website to access the evaluation form. On completion of this evaluation form, you'll be redirected to a page enabling you to print out your own certificate of attendance. If anyone has any follow-up questions, then please do email us at discover@salts.co.uk. Thank you for watching, and we're looking forward to seeing you all very soon.